curative treatment. Since the sound is the instrument best adapted to the cure of stricture, and since, unfortunately, it is easier to use a sound wrongly than rightly, a few words on the use and effects of sounds are required. The surgeon attacking a stricture of the urethra may fairly analyze the therapeutic problem thus. Here is a scar with a congested surface. Shall I cut or shall I massage it? If he cuts through it, the symptoms are relieved, the obstruction is apparently removed, but the scar is still there. In fact, there is rather more scar than ever, and if the former scar contracted and gave trouble, so much the more will this one. To prevent this, he will keep the lips of the wound separated by sounds so that it may heal with so broad an insertion band that the contraction will be of no moment. Such a course will succeed in the pendulous urethra, but if the stricture is in the perineal urethra and of such density as to give the shadow of an excuse for cutting, it will certainly relapse after the operation unless subjected to systematic massage by sounds. The knife only relieves the congestion plus a temporary relief of the contraction, while the sound actually causes the resorption of the exudate. The effect is quite comparable to the effect of massage applied to the outside of the body. Moreover, the maximum of effect is produced by the minimum of effort, or, as Guion puts it, the effect is due not to the pressure of the sound, but to its mere contact. It is a matter of everyday experience that the brutal passage of a sound, bruising and tearing the congested urethra, is followed by a sharp inflammatory reaction, which increases rather than diminishes the exudate. Such treatment is inexcusable. The stricture is already congested, the mucous membrane already inflamed. What more futile procedure than to add irritation to irritation? Such is not the object of the sound. On the contrary, the sound, if a metal one, should slip in almost by its own weight, slowly indeed, but surely. Such a maneuver has the treble effect of lessening congestion at the point of contact, straightening out irregularities in the canal, and stimulating the deeper tissues to a favorable reaction, which will result in softening the cicatrix. But to do this, the sound must press without bruising. If a given sound will not pass, try a smaller one. The effect is readily judged. If a sound is properly introduced, it may usually be followed by sounds of the next larger sizes with less pain than the first. Larger sounds may be introduced at each sitting. The rapid amelioration of the symptoms shows that the congestion is relieved, the obstruction is disappearing, and the canal is resuming its normal condition. Yet, however gently a sound is introduced, it will be followed within 48 hours by a congestive reaction of more or less intensity. Hence, in treating stricture by dilatation, it is bad surgery to introduce instruments, unless filiforms, before the lapse of 72 hours, and even longer intervals will often produce better results. Lastly, and above all, gently, gently, gently